Member for Law. The question is that the bill be now read a second time, and I call the member for Lyne.
Lyne. Thank you, Mr Deputy Speaker. I rise to speak about the Australian National Preventative Health Agency Abolition Bill. This will repeal the 2010 bill that created the agency, and as a result of this bill, the Australian National Preventative Health Agency will be abolished. I wish to explain, Mr Deputy Speaker, why. Essentially, we have a massive duplication of roles and responsibilities, a duplication of the bureaucracy with the creation of the AMPA. Mr Deputy Speaker, you must remember we do have a Department of Health with its own section dealing with public health issues. We also have 6 state governments with their Departments of Health and similarly their sections of public health. We all know that prevention is better than cure, and we all know and appreciate that fact, but we also know that duplicating bureaucracies just increases costs, confusion, duplication and less outcome. It won't, I beg to differ, increase health outcomes. I think it will inadvertently just lead to a waste of a lot of money. I see this recurring pattern of behaviour with the previous Labor government. They identify an issue active in or live in the community, and they think the answer is to create another bureaucracy. It's quite a regular phenomenon. Increasing bureaucratic activity doesn't necessarily lead to the outcome that will fix any problem. Now, the focus of the Department of Health on alcohol abuse, obesity and smoking will remain, but we won't have the duplication of office leases, increased number of staff, increases in committees and duplication of secretariats. The existing commitments and the essential ongoing functions will be resumed by the existing Department of Health. This isn't going to affect the state departments of health because it's 100% federally funded. It was created to help the departments of health in the states, but as of the announcement of this bill, there had been no approaches whatsoever by the state departments of health. Not one thing had ever been referred to them. Now, we all know that too many Australians consume too much food, too many calories, and they don't get enough exercise. We know that too many of us consume too much alcohol and that we binge too often rather than in moderation. Everyone in Australia, I'm sure, knows that smoking is bad for your health. Unless you've been on a desert island for the last 40 or 50 years, everyone knows that smoking is bad for your health. So without issuing motherhood statements, we might need a website. That's the answer. If you have a problem, let's create a website after we create a department and we create a lot of subcommittees. How often have we seen this phenomenon? Not only do we have the magic pudding school of economics that the opposition goes through before they get into parliament, we have the let's create a committee school of thought. Now, I am quite sure the state departments of health can get the message out. And not only do we have the 6 departments of health and the Federal Department of Health, we have an army of general practitioners, specialists, dietitians. We have TV shows occupying the fat space and trying to get people to lose weight and do more exercise. We have an explosion of cooking shows, even with kids in them, children in them, learning how to use unprocessed food in a good fashion rather than highly processed, highly calorie-dense foods. So we have an explosion of information. Even the Sunday papers now have a lifestyle section with lots of healthy recipes and examples of what to do and what is bad. So, look, Mr Deputy Speaker, we just need to stop and think. Do we relieve that inner bureaucratic urging that some governments have Or do we just stop the bus, get off and see where we can use our health dollar better? There are 23 outside agencies doing the functions that the Department of Health is charged with doing, and ANFA is just one of the most recent. Now, I know there's a lot of august experts that have been assembled by ANFA, but I just went to their website and there are not one, not two, not three, not four, but 5 expert advisory committees to the agency. One on research, one on alcohol, one on obesity, one on tobacco. And then we have the National Evaluation Advisory Committee, which has an unlisted number of members. So on research we have 9, alcohol we have 7, obesity we have 8, tobacco we have 9. So all these committees report to the CEO, who then advises an advisory council. This is a merry-go-round of meetings and committees and advisory bodies. Now, as I said, I've looked at the people on these. These are all experts in their field. But really, Mr Deputy Speaker, is this going to achieve what we want? And what we want is behaviour change. And that is so hard to achieve. You can have brochures, you can have TV programs, TV advertising programs, but eventually it comes down to the individual to make wise choices and apply discipline. We can collect all the data that we want. We know an awful lot about the nutritional state of the country and that it has deteriorated despite a profusion and a wealth of food available that previous generations were not so easily available to previous generations. But I think that take-home message everyone has got, and it's up to individuals. Now, some of the other things I looked at, the achievements of ANFA so far, and they are not that impressive when you compare it to the achievements of the Coalition in its previous government. Between 1995 and 2007, the immunisation rate amongst children went from 52% to 90%. In smoking advertising, the graphic health warnings were introduced by our current Prime Minister when he was Minister for Health. 30% graphic health warnings on the front of a pack, and 90% of the pack was covered as well. Smoking rates from 1998 to 2007 had the biggest drop on record, from almost 22% to 16.5%. Gardasil, the human papillomavirus vaccine, has had 6 million doses administered between 2006 up to 2010. During the Coalition's last term of government, 8 new medical schools were introduced. As opposed to this, the more notorious achievements of ANFA were a fat tax study that resulted in no change whatsoever, but they managed to spend $463,000 studying it. They created a virtual or a fake smokescreen festival that annoyed most people that went to the website, and there were very few that did, but the cost of that was $236,000. We've had previous speakers mention the Summer Nats program to sponsor burnouts, $129,000. So, Mr Deputy Speaker, the take-home message is this is reducing red tape. There will be savings that can go into the increased spending we're putting into the state health budget, 9% every year for the next 3 years, and then 6% in the last of the 4 years. It will mean that there is efficient use of the taxpayers' dollars. All the functions that ANFA was tasked with do were duplications, and there was confusion about responsibility, and as far as I can see, no net improvement, although there was a lot of bureaucratic activity. Individuals change their lifestyles. Committees don't. We can have as many brochures as we like, but it's up to individual responsibility and individual choices to get healthy. And I commend this action that this bill will lead to use our health dollar wiser. Thank you, Mr Deputy Speaker.